Hello, my name is Amir. I'm pleased to say that I'm a dental surgeon. I'm actually a little dentist working on my own in a small practice in a little town called Havant in the United Kingdom. And I'm here to talk to you, a budding doctor or a dentist or a dental therapist, about liver disease and cirrhosis, about liver disease and hepatitis, and in particular, patients who are jaundice, so that you would know what to do and you certainly would know what to say should you ever be confronted or presented in an exam with a patient who is jaundice. And that's the first question, isn't it? Would you agree with me that this imaginary patient, whom we're going to call Mrs. Horn, a 70-year-old patient who's pretty much jaundice in that slide, is jaundice or not? And if she were very jaundiced like Mrs. Horn, what would you do? What would you say? Well, the first thing is, you tell the examiner, I would like to put our patient, Mrs. Horn, on the good light. The light in June, like this morning, is very good. The light in December is not so good. I would put my patient, Mrs. Horn, on the good light, and I would wait till we get home, and I will tell you all about jaundice and all there is to know about jaundice. Patients who are jaundice, so that you would know what to do and you certainly know what to say should you ever be confronted or presented in an exam with a patient who is jaundice. And you would put Mrs. Horn on the good light and you would look at inner eye and you would look at the sclera of the eye. You look at the sclera because the sclera is white in color and shows up very well. And in order to do that, you depress the lower eyelid and you look at the yellow staining of the sclera. And you tell the examiner, I think my patient is jaundiced, deeply jaundiced, and he will say to you, make sure by looking at the sclera, and you tell him that you have, and she is pretty much deeply jaundiced. The next question the examiner is likely to ask you is, are there any other conditions where you can get a yellow sclera, bar being jaundice? You tell the examiner no. I mean, there are other causes of yellow pigmentation of the skin, but they don't usually attack the sclera. The examiner will agree with you. And the next question he's likely to ask you is, in what is the likely cause of Mrs. Horn's jaundice? Or may say to you, what sort of jaundice are there? You tell the examiner there are 3 sorts of jaundice. 1, jaundice that is caused by liver cell disease, which we call hepatocellular. 2, jaundice that is caused by obstruction to the liver, biliary obstruction. And 3, hemolytic jaundice, that is excessive breakdown of red blood cells, because bilirubin, that is the name we give to this yellow stuff, comes largely from breakdown of red blood cells and that of hemoglobin. The examiner will agree with you and will say to you, in view of Mrs. Horn's jaundice, which is pretty much deep and severe, what do you think is the likely cause of Mrs. Horn's jaundice? You tell the examiner that you're pretty much sure that the cause of Mrs. Horn's jaundice is either 1, hepatocellular, that is liver cell disease, or 2, biliary obstruction. I suppose that would be a good bet, because the only thing you're looking at the moment is the depth of jaundice, whether it's mild, whether it's moderate, or whether it's severe. And Mrs. Horn's jaundice is severe, so it cannot be hemolytic jaundice, because hemolytic jaundice is always mild. Patients are not deeply jaundiced. Even if you were to break down all your red blood cells, your bilirubin level will not rise very much. Mrs. Horne's bilirubin level is perhaps 30 times the normal. So you cannot be hemolytic jaundice, because hemolytic jaundice is always mild. What patients have is signs and symptoms of anemia, because that's what's causing the lesion. And if you were to check the liver function, it would be entirely normal. The examiner will agree with you, and the examiner may now try to trip you up a little, and will say to you, what investigations would you now undertake in order to get the cause of Mrs. Horne's jaundice into one category or other? You tell the examiner, without being rude, that you would not undertake any sort of investigations at the moment, but you would merely conduct a pertinent history. And in particular, you would like to ask Mrs. Horne 6 questions. The examiner will agree with you and will tell you to proceed. You tell the examiner, I would like to know something about the color of Mrs. Horne's stools. In particular, has Mrs. Horne's stools got lighter or darker? And I'm afraid, whatever the cause, whether the cause is hepatocellular or that of biliary obstruction, stools become paler and there is a tendency for diarrhea. You mustn't lead the patient. Very much like the examination in chief in the High Court, you mustn't ask leading questions. And so, Mrs. Horne, can you please tell us, have you noticed any change in the color of your stools? Have they become lighter, Mrs. Horne, or have they become darker, Mrs. Horne? Much, much lighter. And have you noticed anything else, Mrs. Horne, about the motions? Yes. Loose, pale motions. The examiner will say to you, how does that fit with jaundice? You tell the examiner, well, what colors the stools normally? Bile or breakdown product of it. Hence, if there is less bile going to the gut, hence less pigment in the stools. We don't call the pigment in the stools bilirubin, we call it stercobilirubin, but it is derived from bilirubin. That is, bilirubin is conjugated in the gut, but then you will perhaps be surprised and confused to learn that later on in the gut, the bacteria deconjugated, making it into stercobilinogen and urobilinogen. And then these can then be absorbed and excreted by the stools and urine, respectively. Therefore, you tell the examiner that after your first question, you're unable to put the cause of Mrs. Horne's jaundice into one category or other, because whether the cause is hepatocellular or that of biliary obstruction, stools become lighter and there is a tendency for diarrhea, as exhibited by Mrs. Horne's answers. And therefore you seek permission to proceed and ask your second question. The examiner will tell you to proceed. You tell the examiner, I would like to know something about the color of Mrs. Horne's urine. Because since the first question was regarding the color of the stools, the second question has to be regarding the colors of the urine. Because stools and urine go very well together. And so, Mrs. Horne, can you please tell us whether you've noticed any change in the color of your urine? Has it become darker, Mrs. Horne, or has it become lighter, Mrs. Horne? Much, much darker. Thank you, Mrs. Horne. Well, how does that fit with jaundice? Well, what colors the urine normally? Again, as I've explained to you earlier on, we don't call the pigment in the urine bilirubin, we call it urobilinogen. But it is derived from bilirubin. But the point about obstructive jaundice and that of hepatocellular jaundice, there is actual bile pigment in the urine. So the urine becomes much, much darker. And therefore you tell the examiner that after your second question, you're still unable to put the cause of Mrs. Horn jaundice into one category or other, because whether the cause of jaundice is hepatocellular or whether the cause of jaundice is biliary obstruction, stools become lighter, urine becomes darker, and there is a tendency for diarrhea. Therefore, you seek permission to proceed and ask your third question. The examiner will tell you to proceed. You tell the examiner, I would like to know whether or not Mrs. Horn has developed an itch in any part of her body. And if she has, can she tell us something about its intensity and duration? The examiner will say to you, why? You tell the examiner that itch is just an irritation of the skin due to high bile salt concentration. They deposit them underneath the skin, and patients usually find itching even more distressing than being yellow. And that usually implies you're dealing with obstruction to the liver, biliary obstruction. And so, Mrs. Horn, can you tell us whether or not you've developed an itch recently? And if you have, can you please tell us a little bit about it? Yes. In the past 4 weeks, I've been itching all over, and I do find itching even more distressing than being yellow. Thank you, Mrs. Horn. And therefore, you told the examiner that after your third question, you're perhaps 25% or 30% swayed now towards the cause of Mrs. Horn jaundice as being due to obstruction to the liver, biliary obstruction. And therefore, you would seek permission to proceed and ask your fourth question by diversifying now. The examiner would tell you to diversify and proceed. You tell the examiner, for my fourth question, I would like to know how all this started. The examiner will say to you, why? You tell the examiner, because patients with hepatocellular jaundice, with liver cell disease jaundice, where every liver cell is affected more or less at the same time by the same thing, be the drug, be the virus, the jaundice is of sudden onset. Whereas if you were to be operated on this morning and the surgeon were to tie up your bile duct, it would take several days before you became jaundiced, and a week or two before you became deeply jaundiced like Mrs. Horn. So the onset is desperately important. Sudden onset, hepatocellular. Gradual onset, biliary obstruction. Light stools, biliary obstruction and hepatocellular. Dark urine, biliary obstruction and hepatocellular. Itch tends to sway you towards biliary obstruction. And so, Mrs. Horn, can you please tell us how you first discovered that you were jaundiced? Yes. A friend of mine, Nancy, pointed it out to me over the garden fence. She said that I was becoming more jaundiced every day. But today she said I looked like a canary. So I went to my doctor. And my doctor didn't even have to look in my eye and said that I was deeply jaundiced. So that's how I discovered it. You told the examiner that after your fourth question, you are now 65, perhaps 75% sure that the cause of Mrs. Horn jaundice is due to biliary obstruction, obstruction to the liver. And therefore you seek permission to ask your fifth question. The examiner will tell you to proceed. You tell the examiner, I would like to know whether there has been any abdominal pain or abdominal discomfort. The examiner will say, why? You tell the examiner, because I would like to rule out things like inflammatory things and things like gallstones. And so, Mrs. Horn, can you please tell us whether you have recently developed any abdominal pain or discomfort? Yes. In the past 4 weeks, I feel bloated. It's not like a discomfort, but it's bloating, and it's around this area. My doctor calls it the right hypochondrium. That's what he says the liver is. Thank you, Mrs. Horn. You therefore tell the examiner that after your 5th question, you are still 75% sure that the cause of Mrs. Horn's jaundice is due to biliary obstruction. Obstruction to the liver, and therefore you seek permission to proceed and ask your final question. The examiner will tell you to proceed. You tell the examiner, I would like to know whether or not there has been any weight loss. The examiner will say to you, why should patients with jaundice lose weight? You tell the examiner, because they have malabsorption of fat. They have a thing called statorrhea. That just means a flow of fat. And together with being off your food, anorexia means patients with jaundice lose weight. And so, Mrs. Horn, can you please tell us whether or not you've lost any weight recently? And if you have, can you tell us a little bit about it? Yes. I've lost nearly a whole stone. I've gone from 67 kilograms to 60 kilograms. Thank you, Mrs. Horn. You tell the examiner that after your final question, you're still 75% sure that the cause of Mrs. Horn's jaundice is due to obstruction to the liver.